My heart's in good shape. I have good cardio health as far as I know. No serious cardiovascular issues of any kind. I do have hypertension that I have to keep under control with medication, and also it was discovered at one point that my blood vessels on one side of my heart are smaller than normal, but other than that I have good cardiac health. I have had occasion, though, in the past to get it checked out to make sure that my health is good. I have in the past experienced some issues with chest pain and shortness of breath, and it was necessary to get that checked out. Now, apparently what happened in my case was that those were anxiety attacks, because the thing about anxiety attacks is they can feel just like heart attacks. But the times that I've been screened for heart problems, everything has turned out very good. A nurse told me one time that an anxiety attack can feel just like a heart attack, and apparently it can. There have been a couple of times that I've gone to the hospital to get checked out for chest pain and shortness of breath, and right away they tell me your EKG looks good. Furthermore, I'll go in overnight and they'll run 3 cardiac enzyme tests, and those come out good as well in the past. I haven't had to have that done in quite some time now, but sometimes, they want to move ahead with a nuclear stress test, and that involves either running on a treadmill or having drugs injected into your system to speed up your heart rate, and they do a test that involves scanning your heart before and after. It's just, you lie on a table and it's this huge instrument, cameras that rotate around your body, and they get before and after images, and that's not a difficult test at all. It involves staying off caffeine basically for that morning or any other kind of stimulant, and it's a really easy test. But those tests sometimes give false positives. It looks like there's a problem when there's not really a problem, but they can't tell if they're getting a false positive or not. False positives look very real, and there's no way to verify it otherwise. So in that case, they may want you to move ahead with something called a cardiac catherization, or a heart cath. And that's where they actually go in to one of your blood vessels and insert an instrument with a camera on it that goes all the way up one of your blood vessels clear to your heart to check out and see whether you have any blockage or not. And I have had one of those. They call it the gold standard for seeing if you've got any serious cardiac issues that need to be dealt with, and it's also a procedure in which they can actually deal with some blockages. If there were to be a need to have a stent put in or something like that, they could actually do that at the same time that they do the heart catheterization. Well, I had this nuclear stress test that came back showing positive one time, and they didn't really know what that was about, so I was scheduled for the cardiac catheterization, which is the gold standard, they say, of heart tests as far as determining what's wrong and what needs to be done. And I don't recall having to do a lot of prep for that test. I think there may have been a little bit of fasting after midnight or something like that, but there wasn't a lot of preparation for that test that I remember. I simply showed up that morning and took care of the preliminary arrangements, and finally was wheeled back into the cardiac cath lab, where I found my cardiologist and 2 nurses. Well, there wasn't a lot of prep for this, as I said. Heart cath, cardiac catheterization, isn't anything that requires a knockout drug. It isn't anything that requires any anesthesia. I think the area where they inserted the instrument might have been numb slightly, but that was about it. I was fully conscious and fully awake as they were going through this procedure. And the way that it works is the cardiologist inserts his instrument into either a vein or an artery. I'm not sure which. In my case, it was in my left leg right below the groin as I'm laying on this table. And so he actually inserts the instrument with the light and the camera on it into a major blood vessel and works it all the way up to my heart. And while he's doing that, he's watching everything and recording everything on a closed circuit television screen. So the cardiologist is there and two nurses are there, and he goes through this thing of working his way all the way up to my heart, and I can't feel anything. I can't feel this tube moving through my blood vessel. It's like I feel it going in a little bit down at my leg, down at the insertion point where, it's right below the groin. It's right there on the left side of my leg where he's inserted this thing, and he's sliding this tube with the light and the camera all the way up to my heart. And it didn't seem to take very long at all, because he gets all the way up there and then he starts back down, and I know this was maybe 30 minutes or maybe even less, and he gets to a point where he tells me, "You're okay, everything's looking good, no problem, you're fine." And so he takes it out, and that's pretty much the end of it. Then they bandage the wound, and I go back to a room to recover a little bit. Now, there's no anesthesia or anything like that, but what I have to do is lie on my left side and be very still for a period of time. Now, when they insert this tube into your blood vessel, there is a portion of that instrument that is actually left inside your leg and dissolved. And I think that is to plug the artery or the vein, because if an artery or a vein is open, you're obviously going to have serious bleeding. And so the way this works is they leave a portion of this instrument inserted into that artery or the vein, and that eventually dissolves. But you have to lay there quietly for a period of time, and then they'll bandage it, and pretty soon after that they'll let you go. And the nurse told me, she said, "You understand about bleeding?" And I said, "Yeah, I know I need to watch for any bleeding." And she said, "Well, bleeding from that site is a 911 emergency. If you were to start bleeding there, you need to get help right away. Call paramedics, call an ambulance, get help right away, because that would be a serious emergency, because it's right in a main blood vessel." And so I was instructed that there were to be no lifting for a period of time. Wasn't supposed to put my calf area, the area right below my groin, wasn't supposed to put it under any stress for a period of time. And it was supposed to be bandaged, and I was supposed to go get it checked by the cardiologist and again. And I was told, as I said, to take it very easy and be very careful of any lifting. Now, it tells people anytime they go through this procedure that they don't want to be lifting at all for the period of time that they tell you not to. You don't want any stress at all on that insertion site, because you don't want it to start bleeding. That would be an emergency. So you have to take it easy, avoid lifting, avoid pushing, pulling, avoid stress of any kind on that insertion point. Now, they give you a card you have to carry with you for 90 days. And the reason for that is if there's any kind of an accident or anything like that, the emergency responders will be able to check and see that you've had a cardiac catheterization within the next previous 90 days, and they'll want to get you to a hospital right away to get checked out. But the cardiac catheterization, it does come with some risk. I was told going into that procedure that, oh yeah, there's a very small chance you could die on the table. At that point I think, but I really don't have any choice, because this is the only way we're going to be able to figure out if I've got a problem and maybe get something done about it. If I don't do that, something really bad could happen too. So it doesn't come without risk, but for me it was very easy. There was some residual pain at the insertion site where they inserted that thing, but it was all in all a very easy procedure. I can't tell you not to have any fear at all when they're going into an artery or a vein, and when there's a slight possibility of a serious bleeding risk. And I can't tell you not to have any fear at all when they tell you there's a small chance of dying on the table. But I can tell you that the heart catheterization is considered to be the gold standard of diagnosis, and in some cases treatment of heart problems, and it worked very, very well for me. If you're told that you need one, you probably do need to get one, because at that point they've done everything they can do to figure out if you've got a problem and what that problem might be, and failure to do it could cause you serious problems. So I think when a heart cath is recommended, that you pretty much have got to go ahead and do it. But all in all, there was some irritation from having to lie on my side perfectly still for a while. I did get out of that hospital that afternoon and go home, and then you do have to be careful with the lifting. But cardiac catheterization wasn't a bad experience for me at all. There was no anesthesia required and no recovery as far as trying to get back alertness or anything like that. The main thing was just to be careful with that injury and not put any strain on it, and it worked out fine. And so there's my report on cardiac catheterization and what it is like. Hopefully you find something helpful there if you ever get into that kind of a situation.